If you're over the age of 60 and you have a doctor's appointment coming up, this may be the most important video you watch this year. Because what you're about to hear is something most seniors are never told. Not because doctors are hiding it, but because the medical system was never designed for aging bodies. Every year, millions of older adults walk into routine checkups expecting reassurance. They expect a quick visit, maybe a few lab tests, a polite conversation, and then peace of mind. But for many seniors, that's not what happens. Instead, a routine visit quietly turns into more tests, more scans, more medications, more fear. And often, no one stops to explain whether any of it was truly necessary. Today, we're going to talk about what every person over 60 should understand before their next checkup, so you can protect not only your health, but your independence, your clarity, and your quality of life. And good news, everything we cover today, including a simple one-page pre-checkup action plan, is yours for free. Just check the description below, and please stay with me until the end, because the final insight is the one most seniors say they wish they had known before everything changed. Before we begin, let me ask you something. How old are you, and when was your last checkup? You don't have to share anything personal, but if you're comfortable, drop your age in the comments. We read every response and it helps others feel less alone. Now, let's talk honestly. After 60, your body changes in predictable ways, but medical routines often don't adjust. Many checkup guidelines were written for younger adults. When applied automatically to seniors, they can do more harm than good. This leads to what researchers call cascade care. When one test triggers another, one result leads to more scans, and one, just in case, decision snowballs into treatments you never expected. Large Medicare studies show that a surprising number of tests in older adults lead to procedures that don't extend life or improve daily function, but do increase anxiety, side effects, and hospital visits. And most seniors are never told this trade-off exists. They hear what a test might find, but not what it might start. Here's the key truth: a medical test doesn't end with a result. It often begins a chain of decisions, and once that chain starts, it's hard to stop. Doctors are trained to act on findings. That's their job, but you are the one who lives with the consequences. So there's one question that changes everything, yet few seniors are encouraged to ask it. It's not, is this test routine? It's not, do most people my age do this? It's, what happens next if this test finds something? Because many tests don't bring clarity, they create pressure. Pressure to treat, pressure to intervene, pressure to do something, even when doing nothing may be safer. Another hidden issue is overdiagnosis. As we age, bones thin, memory slows, blood vessels stiffen, and lab numbers shift. Much of this is normal aging, but medicine often labels these changes as disease even when they'll never cause harm. Treating mild, age-related changes can lead to more risk than benefit, yet seniors are rarely told. This is expected for your age. It doesn't need action. Think of this common scenario. A senior goes in feeling fine, maybe a little stiffer, but independent. A routine test shows something borderline. More tests follow, a medication starts just in case. Side effects appear: dizziness, fatigue, confusion. Suddenly confidence fades. No one asked, was this test actually helpful? That's why geriatric experts now focus less on numbers and more on function. After 60, what matters most isn't a perfect lab report. It's walking without fear of falling, thinking clearly enough to manage daily life, staying in your own home, avoiding unnecessary hospital stays. Any test or treatment that threatens those goals deserves a pause. And that brings us to the most dangerous phrase in senior care. Let's do this just in case. Because just in case usually means low chance of benefit, real chance of harm, especially when you have no symptoms. Major medical groups like the American Geriatric Society now warn against routine testing in older adults unless it clearly improves outcomes that matter to you. Yet fear drives compliance, fear of missing something, fear of cancer, fear of being irresponsible. Here's the good news: you don't need to argue, you don't need medical training, you don't need to refuse care. You just need to slow the process. These three questions protect seniors more than almost anything. What problem are we trying to solve? How will this change my daily life for better or worse? What happens if we don't do this right now? Good doctors welcome these questions. In fact, geriatricians say they are the sign of an empowered patient. Because after 60, medicine isn't about more. It's about meaningful. Let's talk about the 5 silent shifts in your body after 60. Natural changes that reshape how you respond to care. Shift 1, your metabolism rewires after 60. Your liver and kidneys process drugs more slowly. A dose safe at 50 may be too strong at 75. The Beer's criteria: a trusted list of medications risky for seniors, flags over 30 common drugs that raise fall risk, natural changes that reshape how you respond to care confusion, or kidney strain. Yet nearly 1 in 4 adults over 65 take at least one, often unknowingly. Examples: sleep or allergy meds with anticholinergic effects can silently dull memory. Daily NSAID like ibuprofen raise blood pressure and kidney risk. Even supplements like iron or calcium can build up if kidneys aren't clearing well. Bring all your meds, prescriptions, supplements in a bag. Ask, is everyone still needed? Could any be causing fatigue, dizziness, or brain fog? This brown bag review is one of geriatrics' most powerful tools. Shift 3. Shift 2. Your immune system gets overactive. Immunity doesn't just weaken, it becomes noisier. Think of a fire alarm that chirps for burnt toast. This low-grade inflammaging is linked to heart disease, arthritis, and even depression. But routine inflammation tests like CRP often show high results in healthy seniors. That doesn't mean infection or cancer, it may just be normal aging. Yet too often, a mildly elevated number triggers CT scans, biopsies, or antibiotics. Ask, could this be from age, arthritis, or dental issues, not something new? Shift 3. And even depression details may slow, but your wisdom, judgment, and long-term recall often improve. The challenge is retrieval lag, that tip-of-the-tongue moment. It's not dementia. It's your brain filtering out noise to focus on what matters. Yet rushed exams and noisy rooms can make normal lag look like impairment. If a memory screen is suggested, ask, is this because of a real change I've noticed or just routine? And if routine, how will it change my care? Shift 4. Your blood pressure has a new sweet spot. For years we heard, lower is better. But major studies now show, in adults over 75, pushing systolic pressure below 120 can increase falls, fainting, and kidney injury. Why? Stiff arteries need slightly higher pressure to keep blood flowing to your brain, especially when you stand. Current guidelines recommend, most over 65, target under 130, but not below 120. Frail or fall-prone. Under 140 may be safer, yet many clinics still aim for less than 120 automatically. Bring your home readings. Ask, what's the lowest my pressure should safely go, especially when standing? Have we checked it standing, not just sitting? Shift 5. Your body hides hunger and thirst cues after 60. You may not feel thirsty, even when dehydrated. You may not feel hungry, even when undernourished. This leads to silent weight loss, a major red flag. Losing just 5% of body weight in 6-12 months doubles the risk of disability and hospitalization. Yet it's often brushed off as just aging. Ask yourself, are my clothes looser without trying? Do I skip meals because I'm not hungry? Do I drink coffee or tea instead of water? Nutrition isn't about weight, it's about resilience. After 60, you need more protein, not less, to protect muscle. Simple fix. Add 1 palm-sized protein portion per meal: eggs, yogurt, beans, fish. Small change, big protection. Now let's talk about polypharmacy, taking 5 or more medications. Over half of adults over 65 do. Nearly 1 in 5 take 10 or more. Each extra drug raises the risk of interactions, side effects that mimic aging, and missed doses. But here's what few know. Up to 40% of medications in older adults may be unnecessary or harmful. That's from major studies in JAMA and the BMJ. Deprescribing, carefully reducing or stopping meds that no longer help, is safe, supervised, and powerful. Common candidates: PPIs like omeprazole, meant for short-term heartburn, but long-term use raises fracture risk. Statins, for primary prevention in adults over 75, benefits shrink while side effects rise. Sleep aids like zolpidem or lorazepam double fall risk and impair memory. How to start? I've been on med for X years. Could we review if it's still helping or if risks now outweigh benefits? Many doctors want to prescribe, they just wait for you to bring it up. Let's talk about the waiting room. You sit, you rehearse. The doctor walks in, kind, busy, glancing at the screen. You start to speak and stop because you don't want to be difficult. Because you think, they'll tell me if something's wrong. But studies show physicians interrupt patients after just 11 seconds on average. That's not enough time to say, I feel sharp in the morning but foggy and unsteady by 3 p.m., or I catch myself more like my legs are half a step behind. So prepare one headline sentence, your core concern, in under 15 words. I've lost 8 pounds in 3 months without trying and I'm worried. I'm on 9 meds and I want to make sure none are working against each other. Lead with that, then pause. That one sentence resets the visit. It says, this is what matters to me. Now, common tests and what to know before you say yes. Annual EKG. The U.S. Preventive Services Task Force says Do not screen asymptomatic adults over 60. Why? EKGs in healthy seniors find mostly harmless changes, but those can lead to stress tests, referrals, and anxiety with no drop in heart attacks. Ask, is this because of symptoms or just routine? PSA for prostate cancer. For men over 70, especially with other health issues, routine screening is no longer recommended. Why? Most prostate cancers in older men grow slowly. Treatment often causes incontinence or sexual side effects, with little survival gain. Ask, if my PSA is high, can we monitor instead of biopsy? Routine vitamin D test. Unless you've had a fall, fracture, or osteoporosis, routine testing and high-dose supplements rarely help. Large reviews show they don't prevent falls or extend life in healthy seniors. Ask, is this test because of a specific concern or just habit? Repeat bone density scan, first DEXA, crucial. Repeat every 1-2 years, usually unnecessary. Bone changes slowly, less than 1% per year. Small scan differences are often just measurement error. Guidelines say, wait 5-10 years if results are stable. Ask, based on my last result, when is the next DEXA truly needed? Let's decode symptoms often dismissed as just aging. Afternoon fatigue, not morning, could be blood pressure drop after meals or med side effects. Ask, could my tiredness be linked to meals or meds? Unintentional weight loss, major red flag even if you feel fine. Track weekly. Report more than 5% loss. Near falls or clumsiness could be vision, balance, meds. Or B12 deficiency, all treatable. Ask for a simple balance review. Memory blips, only for names if you still manage bills, drive, and recall old memories, likely normal. Red flags, forgetting how to use objects, getting lost, personality shifts. New constipation, don't just take laxatives. Could signal thyroid issues or motility problems. The goal isn't to fear every change, it's to distinguish normal aging from signals worth exploring. Now, your pre-checkup action plan. Do these before your visit and walk in as a partner, not just a patient. The 3-column sheet grab paper. 3 columns, what's working well, what's changed, what matters most. I walk daily. I sit to put on shoes. I want to see my granddaughter graduate. Bring it, takes 30 seconds, changes everything. The med bag, all pills, supplements, inhalers in one bag. Ask for brown bag review. Your headline sentence, I'm here because, keep it short, lead with it. Bring support or record a friend helps. Or ask, may I record this for my notes? Most say yes. Your stop list, write down. Test you're unsure about, meds you struggle with, goals you won't compromise, like stay at home as long as possible. This isn't defiance, it's clarity. Here's the truth no one says aloud. The most powerful tool in senior care isn't a drug or a scan, it's protected time. Time to listen. Time to explain, time to choose, and you hold more of that power than you think. Because true consent isn't signing a form, it's understanding what you're saying yes to. And that begins with one sentence. Can we slow down for a moment? That's not pushback, it's partnership. Let me leave you with Margaret. She was 79, retired teacher, lived alone with her cat, went in for her annual physical. Felt fine, doctor ordered a chest x-ray as part of the panel. Found a small lung nodule, next CT PET biopsy. The biopsy caused a collapsed lung, 10 days in hospital, 12 pounds lost, rehab required, the nodule benign, an old scar. She later said, I wish someone had asked Margaret, what are you most afraid of? I'd have said, losing my independence, and they'd have known the risk wasn't worth it. Her story isn't rare, but it is preventable. Because after 60, healthcare shouldn't chase every number. It should protect what you love, your coffee in the morning, your walk in the garden, your grandkids' laughter, your quiet evenings in your own chair. That's not just living, that's thriving, and you deserve a system that honors that. So try just one thing differently at your next visit. Bring the 3-column sheet. Ask the 3 questions. Say, I'd like to think about this. Can we talk next week? You don't need to do it all. Just one step. Because small shifts in how we prepare, speak, and listen create ripples. Those ripples, they become waves. All the tools we discussed, including your printable pre-checkup action plan, are free to download in the description below. Now I'd love to hear from you. Have you ever left a checkup feeling worse than when you arrived? Has a test ever led to something unexpected? If you're comfortable, share in the comments. Your story helps others feel less alone. If this helped, even a little tap-like, it helps others find this message. And if you want more honest, calm, research-backed guidance for aging well, consider subscribing to Age Honestly. Thank you for watching and take care of yourself. Not just your body, your spirit, your peace. You've earned it.